And good afternoon, October 22nd, 2024. I'm Dr. Debridement, and our patient has a serious problem. He has infection in his discs at L3-4, L5-S1. And we're going to go in there, we're going to get some samples of that infected material, send it to the lab, but we're also going to clean out as much as we can, and we're going to put some antibiotics in there, and then we're going to put some bone graft to cause a fusion. So we're going to get started right now. We're going to do all this endoscopically so we can avoid an open surgery. I'm going to give you some numbing medicine, okay? Is he sleepy?
Yeah.
All right, good. Little stick, a little burn. If you have questions, feel free to ask us. Once again, this patient has infection of the spine in the disc called discitis, epidural phlegmon. There is no abscess, as far as I can tell. If there is, it's just a tiny one. And I'm going to go in and try to clean it all out with this surgery and put antibiotics. All right, should be a little higher. Numb. That's nice. No. First, we're going to put some numbing medicine. I'm going to get into the 5-1 disc. You can see it's very steep, the angle of the disc. It's not typical. It's really angled up. Shot. All right, pretty close to where I need to be. Shot. If you have questions, feel free to ask. But this is a patient with infection of the spine. He's been receiving antibiotics. It has not cleared the infection. He needs an incision and drainage, I&D. That's what we're doing today. It can be done either open or it can be done arthroscopically. AP? We're going to do it arthroscopic. Why? Less invasive, no downtime, no hospitalization, no big cut on the back, swelling and pain, if we can get in and get this done. Well, let's see. Shot. Shot. I may have to come a little more lateral. Shot. Yeah. Sorry about that. We gotta. Is he awake?
How you doing, my friend? You okay?
Jordan, I need you to line him up. I think everything's going good. He's awake. I think we're see the rabbit ears up at L5. Man, that L5 is eaten up, huh? It's pretty collapsed. There we go. That's better. All right, good. Let me see what I can do here. Shot. Need to be a little more superior. So the hardest part of the surgery is getting into where the infection is in the spine. Shot. There we go. That's progress. And we're doing this in a minimally invasive way. If I was doing this open, he'd have to have a big incision. There'd be a lot of scar tissue, a lot of downtime. Shot. I think this might work. AP. I'm using the X-ray machine to take side views and front back views to guide my surgery. Can you straighten that out a little, Shot? A little more. He's got some scoliosis. All right, that's pretty good, actually. Go lateral. So far, good. How's he doing?
How are you doing, my friend? You okay? You said you're doing well.
Good. This is the worst part. You're awake for this part. We're going to put you to sleep in a minute. Jordan, I think we're off on orbit. Just a little bit of orbit. That's better. Shot? Yeah, that's nice. That's real nice. Any pain?
You having any pain?
No.
Say no, right?
Okay, good. AP. So we're just about there at 5-1. That's the hardest one to do. Look at how the infection is eating the bone away at 3-4. Look at that. Show us the bone that's, ooh. Well, looks good. Jordan, show us the, on the lateral view, how the bone is dissolved. Look at that. No, 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 no. See that 3-4? Look at 3-4. You see the big white thing? There, yeah, huge white area. You could see it on the MRI too, but that's abnormal. Okay. You might think it's a gas bubble, but it's not. It's actually a process going on in the disc space. Are you comfy? Yeah? All right, we're almost done with this part. Good, good. It's going really good for you, my friend. It's going really, really good. Let's numb them up a little bit. Because, yeah. All right. If you have questions, feel free to ask. We're giving you some numbing medicine. I'm sorry. Just bear with us, okay? Any questions, Henry?
At this moment, no current questions.
All right. We're going to place our second needle. We are going to be sending some of this material off to the lab. Does Ameris do it?
He's working on it.
All right. Let me know if you're uncomfortable, okay? Patient is awake at this point. I need him awake just for this part of the surgery. He has to guide me. If I get too close to the nerve, he needs to tell me. Jordan, I don't know what you're doing. Drop the table a little bit, maybe. Dr. B, drop it an inch. A little more. All right, that's fine. You can see it's bloodless surgery. We don't lose any blood. Sean, go ahead and ask questions. This is the second infected disc case we've done in our center in the last 2 years. Sean, we did a, yeah. The other guy was from Puerto Rico. And this is a much better option than open surgery. Much better for the patient.
He did really well.
Oh, he did great, yeah. Sean? I remember his name. I never remember names. You okay? Where do you feel it? AP? In your back? I can't hear him.
Where are you feeling it right now, sir? Let's say it again. He says top where you work it to the right.
Yeah, that's fine. That's where we expect it. We're right next to your facet joint. Your facet joint does have some arthritic changes, probably related to the infection. We're almost done, okay? I mean, we're almost done with you being awake. Man, I can see the herniation on the x-ray. Where do you feel it? Your back? All right, we're going to put you to sleep in just a minute. Let's do a quick discogram. Should be okay. Mm-hmm. You have back pain, right? How bad is that on a scale of 1 to 10?
Give us a number. 9.
Is that where you get your back pain? Yeah?
Sometimes he said no.
Yeah. But that's where you get it, right?
So yeah.
Okay. So we just tested the 3-4 disc, which is where he has an infection. That's the second place of the infection. This is really stiff, Luis. You have a different guide wire? You have another guide wire? I'm going to put this on the floor.
Okay.
It's right here.
That's right.
Thanks. I think it was just kinked a little. It was kinky. All right, let's test 5-1, and then we can put him to sleep. Any
You're doing great,
questions?
my friend.
Yes,
You're really doing
we
well.
have a question coming from Fernando on YouTube.
How bad is that on a scale of 1 to 10?
9.
Both of them were 9s. Okay, he's got 9 out of 10 pain at both this. 3-4, 5-1. Discogram is concordant. Great news. We're in the discs. They're both painful. That pain will be gone when we're done. We're going to get in there and clean out as much infection as we can. Take it.
Close your eyes.
Count from 1 to 100. All right, Fernando, we'll take your question.
Fernando asks, how long does it take to heal?
Interesting. It depends on what you're talking about, Fernando. Are we ready? Can I start? Yeah, take your time. Let me have the stylet back. Fernando, it depends on what you're asking about. The skin heals in a week. The muscles take about 2 weeks to heal. And the disc takes basically, let's just say 1 year to completely heal. But this patient will be going home in an hour after his surgery is over. We'll be done in 45 minutes. He'll go home in an hour. All right. You can see there's minimal bleeding. If we did this open surgery like most surgeons would do, it's far more invasive and it's worse for the patient to do it open. The infection can spread more. You can have complications. But with this surgery, we've never had a complication. And again, we're not here to treat discogenic pain, that we are going to fix his discogenic pain. We're here to treat an infection. He has a bad infection in the spine. The patient has been treating with antibiotics. I can feel the herniation right here with the tip. Show us the tip of the dilator. See the tip right there? There's something bulging backward. I'm literally pushing against it. It's not supposed to be there, but it's in the foramen. It's hitting the nerve. We're going to go in and we're going to clean this thing out. Shot? So we're doing this surgery because of infection. He has an infection in both discs, 3-4, 5-1. Right now we're going to put our tube in. I'm going to get in there. I'm going to grab some specimen. I want you to label it separately. One will be L3-4, the other one will be L5-S1. I want both the culture thing and I also want little urine, sterile urine container so we can put some tissue sample. Okay? Whatever you normally send the disc fragment in.
Yeah. That's your.
And we're going to call it infected disc L3-4 or infected disc L5-S1. All right, folks, we're going into the first infected disc at L3-4. He injured these discs with a work injury, but what happens when you injure a disc is you get inflammation. And the inflammation is where your body sends all this blood to fight a process. Why is the irrigation? What do we have in the irrigation? There's no antibiotics, right? All right. So you get an injury to a disc, your body sends inflammation process to the disc to fix it, and you get all this blood there. And guess what? If you have somehow bacteria in your body, it's going to go to where the inflammation is. Okay? It's kind of like a river. Okay, take that. That's 3-4. And this is infected disc. Okay, all of this is infected disc herniation, infected disc herniation. Just collect it all and then you can put it in.
Yes, sir.
Okay, any questions?
At this moment, no current questions.
All right, I think we have enough specimen, right? How much you got? No. Just, where are you going to put it?
Well, I can set it over here. For now.
You're going to know that that's 3-4.
Yeah. So
Here's some more. Save all the 3-4. I want some of it going in for histopathology, right? And I want some of it going in for culture. So 2 separate specimens. Then we're going to do the same thing at 5-1. The reason there's so much blood, folks, is because of the infection. Luis, I need your help. Just keep your 3-4 separate. You don't need to involve anybody else. You can do it all when the surgery is over, okay? Just put it in a pile right there and put L3-4. I need the grabber. Any questions?
At this moment, no current questions. So in the meantime, why don't we show the audience of how a herniated disc causes back pain?
I think it's a great idea. Let's show them the 30 causes of back pain.
Perfect.
You can see I put the grabber in there. There's so much inflammation that it's causing just the oozing of blood. That's because there's so much inflammation. We don't normally see this with infection. I'm Dr. R. Duke Majan with the Duke Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Duke laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Duke plasma rhizotomy of the SI joints offered at Duke Spine or Duke Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Duke piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, such as the vertebral bodies, with trauma can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Duke Majan. Thanks for joining us. And welcome back. Now our video is about the 30 causes of chronic back pain. You just watched it. Doesn't mention infection as one of those main causes because infection is a very rare cause of chronic back pain. And the reason for that is when you get an infection, you go see the doctor and they treat it. So it's not really chronic back pain because the pain goes away when the infection goes away. In this patient, he has an infection in his spine in the two discs, L3-4, L5-S1. We just got through debriding the L3-4. In other words, we cleaned out as much of the infection as we could from inside the disc and just outside. I put antibiotic powder, that's the white powder, it's called vancomycin, and I put bone graft, a little bit of bone graft to try to cause a fusion because we don't want to have to come back again and do a fusion later. I'm hoping that his bones fuse and gets rid of his pain. So we did a debridement, we did a antibiotics, we did culture, we did antibiotics, and we did fusion. So, and we did the Duke laser disc repair. We did it all. All right, that's our picture. Next is L5-S1. Needle out. By the way, it was very bloody. Why? I told you already why. Because the inside of the disc is bleeding. And that's from the abscess or infection that's happening. Phlegmon, which is an infection, causes the tissues, causes the tissues of the body to get very red, swollen, and bleed. And that's what we saw. We saw an infectious phlegmon. Phlegmon, phlegmon. Walled off is abscess. This patient doesn't have too much abscess, thank God. He's got more phlegmon. Let me have it. You know? All right, so I'm going to pull the guide wire back a smidgen, and then I'm going to advance this dilator over the guide wire. Any questions? Sean?
Yes, we have a question. Oh, just got another question.
Sean?
This first one coming from Darcy on YouTube,
Hi, Darcy.
asking, is the amount of bleeding a concern?
No, the amount of bleeding is not a concern. It's normal. Hold on. It's normal, yeah. It's normal to have that bleeding. It is more than we ever see with just the Duke laser disc repair. But then again, when we do a Duke laser disc repair, we're doing it for an annular tear and a disc herniation. We're not doing it for an infection. So this patient has infection in both discs. So the reason why there's all this blood is because of the inflammation that's happening inside his disc and around the back of the disc. And that's what infection does, right? If you have a pimple, it's infected, it's red, it's swollen, and if you pick at it, it starts bleeding like crazy, right? Well, that's the same thing. He's got basically a pimple in his disc, and we're in there to clean it out. Kind of like squeezing the pus out of your pimple, right? You pop the pimple, get the white stuff out, then it can heal. But we're also going to put an antibiotic in there to clean it out. Not just the antibiotic, but we're using betadine as well. Okay, here we go. This is the next one. You can actually see the pus. Look at the color here. It's white. You guys see that?
Yes, we can.
Right here. You see, I don't know if you can see this.
Yes, we can.
Right where my fingertip is. That's white stuff. That's white blood cells. Okay? White blood cells is pus. Pus is white blood cells. And that's what we got. We're just popping the zit. We're hoping to do this way rather than open surgery. 5-1.
5-1.
Make sure you send this for gram stain, culture, aerobic, anaerobic, fungal. 3 types of microorganisms. Viruses do not cause pus. Viruses do not cause abscesses. So we're not worried about a virus and the kinds of things that can cause a pussy disc or infected disc. Here's a good piece of herniation right here. Oh yeah, there's a good one right there. The kinds of things that can cause an infection like this are fungus, bacteria, and really one more thing, it's called protozoan, but I mean, you'd never see a protozoan infection of the disc. Wipe the tip. Protozoans are things like Giardia, Entamoeba histolytica, what else? Malaria, which is Plasmodium falciparum, or one that's near and dear to me, which causes disease in coral, is philaster. Okay, philaster. So, long story short, this is not a protozoal infection. This is either bacterial, or it's bacterial, or it's bacterial, or it's fungal. And the chance of fungal, in my opinion, is like less than 5%. It's no. I mean, fungal infections are more common in the spine of AIDS patients, people with, chronic immune suppression, like HIV, AIDS, or hepatitis, or diabetes, or chronic steroid use. But in a young, healthy man, it's bacteria, 99% of the time. All right, cleaning out the infection. So far, so good. I'll get the laser in, try to clean out a little more. So I believe he has bacterial discitis, epidural phlegmon.
He's a marine mechanic, so he works around.
Yeah. But even working around the marine environment does not increase the likelihood of infections of the spine from bacteria. So I think he injured his disc and then it got, full of inflammation and somehow maybe even had like a dental procedure. I don't know. And something from his mouth scraping around the mucosa. It got in there and spread to his spine. Damn, got some garbage in the front of the wipe. This stuff is sticky, by the way, very sticky. Bacterial stuff is sticky. It has something called a glycocalyx, which is a coating around the bacteria. Laser, probably. Let me see if I can grab some of that. That's all herniation and infected material right there. Infected disc material. Oh yeah, and the disc is a great place for bacteria. They love it because there's no blood supply. Very minimal blood supply to no blood supply. Depends on what part of your disc you're in. So this disc is a wonderful place for bacteria to grow because our body's defense system relies on the blood system. Right? Blood supply. That's how our defense system gets there. Whether it's the immunological system or it's the inflammatory system, both of our defense systems, immunological and inflammatory, rely on blood supply. Therefore, the disc, center of the disc, which has no blood supply, is protected from our defense system. So any kind of bacteria that gets to the disc and starts to grow in the middle of the disc, it's basically home free, Your body cannot mount an effective defense against it and eradicate it. All right, just about done. 10 minutes max.
We have a couple questions.
Oh, sure, why not?
This next one coming from Vinny on YouTube.
Hi, Vinny.
asking, I feel like I have 3 of the 30 symptoms. Does insurance cover any of the surgeries?
Great question. Does insurance cover any of our surgeries? The answer is yes. It depends on your insurance. We have, like, for example, the problem with insurance, look at all that red stuff, by the way. That's all inflammatory tissue. Insurance depends on, like, Blue Cross Blue Shield. Let's just pick them. They have 1,000 different plans just in Florida and Georgia, like the Southeast, right? And all those plans have different benefits. So they cover different drugs, different treatments at different levels. And the problem is, we're done. The problem is, Vinny, is that every plan is so different that we would have to get a copy of the summary plan document to look at each plan, to know. And even then, insurance companies just pick and choose. Let me have the grabber. Whatever they want to pay for. And sometimes they'll say they'll cover it, and then they don't. And then sometimes they say they won't cover it, and they do. But what I found is that the best insurances do cover our procedures. But it's sometimes impossible to tell what will be covered before surgery. So what we typically do is, depending on the insurance, we're going to ask you for some money up front to cover some of our costs in case we're left holding the bag. All right, I think that's good. I don't know if that answers your question. All right, that's really good right there. We cleaned out the disc. That's the end of the disc right there, the very most superficial part of the disc, 5-1. I've gotten all the junk out of there. I'm going to debride it, or irrigate it, I mean. We already debrided it. We're going to bring our betadine in. This is powerful stuff. It kills everything. Virus, fungus, it kills everything. And betadine is wonderful stuff developed by NASA, really to protect the astronauts and civilization. When the astronauts come back from space, they were worried about them bringing back some kind of microscopic aliens that would take over Earth, kill everybody. So they created betadine, which kills everything. We're done. That's why we put the betadine in there. All right, now we're going to put some vancomycin powder. Here, come on, help me. I need you having it ready. Put some more. Wish there was like a funnel. Here, ready? This vancomycin is really good antibiotic. That's why we use it. I'm going to put some more.
We do have another question.
Oh yeah, I'll take the question, Henry.
Coming from Sherry on Facebook asking, can it come from an epidural injection? My guess is yes. Okay.
Yes, you can get infections of the spine from injections. That's the most common way people get infections of the spine, is from injections, like epidural. Epidural injection is the most common reason people get infections of the spine. Basically, doctors give them an infection. That's it. We're done. Good job, everyone. Let's hope and pray this works. I'm happy with the way it went. But yeah, look how much more bloody this thing is than normal surgery, right? You guys have watched hundreds of these surgeries. I need something to clean this area up. Can you give me? Sorry, I don't mean to gross you all out, but this is all because of the infection. Crazy, huh?
You did great, my friend. Your procedure surgery's all over.
All right, any other question?
No current questions.
Well, folks, we appreciate you joining us. We're done. We lost about 10 cc's of blood, which is 10 times more than normal. And he did great. I got everything done I wanted to. We cleaned out 2 discs, debrided, hopefully got rid of the infection, put in antibiotic powder, vancomycin specifically. We sent off cultures, gram stain, tissue culture. We're going to look at the tissue, see if it's showing evidence of infection, but also cultures for aerobic, anaerobic, and fungal. 3 things, guys: aerobic, anaerobic, fungal.
Just
And then we put in some bone graft after the antibiotics to try to cause the bones to fuse. Because if they can fuse now without using hardware like screws, rods, then his body can clear the infection because we're not putting screws and rods. You're not putting a foreign body in there. I think it's a really good chance he'll fuse. Any other questions?
No current questions.
All right, thanks for joining us. We'll be back next week on Tuesday with more fun at Duke Spine Institute with our live streams. Again, this patient had 2 infected discs in his back, and we've just completed his surgery, and it went very well, better than I expected. So let's keep our fingers crossed that he gets fixed.